Hello, my name is Shilapakua. Thank you for watching my integrative therapy video. My patient today is a 27-year-old single male who suffers from anxiety since the age of 15. His reason for seeking therapy is that his anxiety is interfering with his work, and he realized that he needs help since his anxiety has caused him to call out of work several times due to fear of doing presentation in front of his boss and coworkers. He reports his anxiety causes him to get flustered and rush through his sentences, which causes him to lose his train of thoughts during presentations. He never engages with coworkers and always turns down social events despite their efforts to include him. His fear of speaking in public prevents him from getting to know his coworkers to form a relationship. His usual activities involve playing video games when he is home from work. He currently takes Xanax, zero point 0.5 milligrams daily, which he reports helps him, but he has been on the same dose for 4 years. He has no other medical history. He reports that his supervisor has been very lenient with him and has not fired him, although he called out every time he has a presentation. He admitted to his supervisor that he has mental illness, and his supervisor advised him to seek help. Patient decided to seek therapy to help him with his social anxiety. As we all know, therapy can help one uncover the underlying causes of their worries and fears, and can also help you to learn how to relax, adapt to situation in less frightening ways, and develop better coping and problem-solving skills. Overall, therapy gives you the tools to overcome anxiety and teaches you how to use them. The three psychotherapy we will be using for this patient are cognitive behavioral therapy, interpersonal therapy, and exposure therapy. Cognitive behavioral therapy, CBT, is the most widely used therapy for anxiety disorders. In his article, Old defines CBT as a blend of behavioral and cognitive interventions guided by principle of applied science. The behavioral interventions aim to decrease maladaptive behaviors and increase adaptive ones that result in new learning. He went on to say that the cognitive interventions aim to modify maladaptive cognitions, self-statements, or beliefs. Research has shown CBT to be effective in the treatment of social anxiety disorders, which our patient is experiencing. CBT is a problem-specific, goal-oriented approach that needs the individual's active involvement to succeed. It focuses on their challenges, thoughts, and behaviors. The assumption of CBT is that your thoughts affect how you feel and subsequently behave. So the goal of CBT is to identify and understand your negative thinking and ineffective behavior patterns and replace them with more realistic thoughts and effective actions and coping mechanisms. Therefore, cognitive behavior therapy will help the individual learn more beneficial ways of thinking and behaving. Next, we will talk about interpersonal therapy. Interpersonal therapy is important for social anxiety disorders since the major goal of treatment is to improve an individual's interpersonal functioning. Although IPT was originally instituted for treatment of eating disorders and depression, recent research shows that because of the interpersonal nature of social anxiety disorder, interpersonal therapy is not considered a potential treatment alternative. Patients with anxiety disorders typically have difficulties expressing themselves. IPT goal of interpersonal and effective attunement may provide an alternative approach for such patients. Interpersonal therapy looks at areas in your life that needs attention. This includes taking account of all the key relationships in your life in the main areas of interpersonal difficulties, such as being socially avoidant or non-assertive. Our patient today have difficulties in all these areas since he avoids relationship both personally and at work. If an individual is lacking interpersonal relationship, the relationship that the individual and their therapist will form will serve as a basis for exploring difficulties and will help the patient learn to develop relationship at work or personally. Lastly, we will talk about exposure therapy. Exposure therapy is a type of behavioral therapy that is designed to help people manage problematic fears. One of the cornerstones for exposure therapy is the principle of facing your fears until anxiety reduces. The patient is gradually exposed to situations that causes them distress. The goal of exposure therapy is to create a safe environment in which a person can reduce anxiety, decrease avoidance of dreaded situations. As we all know, avoidance provides temporary relief, but ultimately maintains the fear, and repetition of avoidance can give more power to the fear entity. Exposure therapy uses a number of methods to support the reduction of emotional responses. Imaginal exposure. In this type of exposure, a person in therapy is asked to mentally confront the fear or situation by picturing it in one's mind. In vivo exposure, when using this type of therapy, or this type of exposure, a person is exposed to real life objects and scenarios. For this particular patient, watching other people give presentations and also recording himself will be a good start to conquering his fears. Lastly, the therapist can employ virtual reality exposure, which combines elements of both imaginal and in vivo exposure so that a person is placed in situations that appears real but are actually fabricated. This combination of therapy will help the patient improve on their fear when it comes to public speaking or forging a relationship with peers or significant others. After actively engaging in this therapy, this patient will be able to engage in conversations with peers and also do work-related tasks, which include presentations, without feeling overwhelmed with fear. This therapy will help our patient tremendously since it will help them stop fearing the worst and face their fears rather than avoid them. I chose all three modalities because they each address a specific issue that the patient is experiencing. Using one or two of the modalities would not be sufficient since each modality targets a specific patient concern. My expectation is that patient will trust me and be open as well as willing to apply what is learned in therapy so we can achieve a therapeutic outcome. Since this patient is of Asian descent, there are many cultural factors that can impact effectiveness of mental health services provided to Asian Americans. These factors include stigma or discrimination against mental illness or people with mental illness. I will disparage any negative views the patient may have concerning mental illness so that I can effectively benefit from the use of it, so that they can benefit from the use of it. In the Asian culture, the use of some traditional methods can be extremely helpful to one's overall well-being. This includes diet, exercises, and other traditional methods like yoga, tai chi, breathing exercises. So when appropriate, I will incorporate this into the sessions. Also, I understand it takes time for some Asian American patients to feel comfortable in sharing very intimate personal information with outsiders. So I'll be very patient with my client so he can easily express himself. Overall, the therapy session with this patient will be successful since all three modalities, which are cognitive behavioral therapy, interpersonal therapy, and exposure therapy, are considered to be empirically supported psychotherapies. Psychotherapy modality number 1, which is cognitive behavioral therapy. Patient. Hello, thank you for coming. Before we get started, do I have your consent to film this session? Yes. How are you doing? I'm doing okay, I guess. So I understand that you are having trouble with presenting in front of work colleagues and also engaging in conversations at work, which is affecting both work and your relationship with others. Is that correct? Yes, that is exactly right. I am so afraid to speak in public and I don't have that many friends because of that. Let's explore a little further into why speaking in public is triggering for you. I thought about this before and I think it started when I was in middle school. I came to this country when I was 11 and I had trouble speaking English. My accent prevented me from speaking since my classmates always laughed at me when I spoke. I try my hardest to not speak in class, but my teacher will always call on me to answer questions. I think in his mind, he was helping me to overcome my fears. But in actuality, it did more damage since I cried every time I went home. Although I lost my accent along the way, I was afraid to speak to people since I assumed they will start laughing at me. I understand how you feel. It seems that since you were laughed at, when you were younger, it's affecting how you relate to others in your adulthood. Yes, I keep thinking my colleagues are laughing or talking behind my back. This is clearly understandable since the way you think impacts how you behave, and how you feel and how you behave also impact how you think and how you feel. And how you feel also impacts how you think and behave. Oh, I see. Essentially, we are not going to feel better unless we change our thoughts, which we will also affect our behavior. I believe for you, you are preoccupied with your thoughts, which is affecting your behavior. So we're going to work on changing your thoughts. Is that okay with you? Yes, I understand. Now, I would like to try a little exercise with you, which will help you, especially when you are feeling anxious about giving presentation. This is a diaphragmatic breathing, which is essentially breathing with your stomach. We oftentimes breathe with our chest, which we are 70% less oxygenated than when we breathe with our stomach. So in order to properly do this, we need to see our belly moving in and out. One of the ways to do this is to cross your hands and put them on your stomach and lean back a little bit in your chair and take a few deep breaths and try to get your hands to move out when you breathe. Now go ahead and try. Okay, so I cross my hands and put them on my belly and take a deep breath. Yes, perfect. You are doing excellent. Another way to also do this is putting your hands behind your head and lean back in your chair and take a deep breath. This increases the ability of your lungs to expand, and of course, you should be seeing your stomach go in and out. This is actually not hard and pretty easy to do. Absolutely. And this breathing technique can be done anywhere before your presentation. Even during your presentation, you don't have to make a loud noise. So earlier, I mentioned that we need to change your thoughts. Have you ever given a presentation that went fine in the past? Sure, I have. Great. So while breathing, we need to add a thought that will go along with the breathing. We need to practice our thinking by bringing those positive experiences into your current situation. So whilst doing this diaphragmatic breathing, we are also thinking, I've done fine before, I can do this. This is great. I think this will help me tremendously. I think you did an excellent job with your breathing technique. I would like you to use this breathing technique all the time. I would like to know how this breathing technique and positive thinking helped you during your anxiety-provoking experience at work. Okay, sounds good. Thanks for coming in. We'll see you next week. Our next modality is interpersonal psychotherapy. Hello, how are you doing today? I am not doing bad, I guess. I understand you came in today because you are having trouble forging a relationship with your coworkers. I like to keep to myself. They probably think I'm weird since I close off and does not like to talk. I think this all stems from the fact that I have social anxiety and scared to open up to people. Okay, so now let's explore your interpersonal relationships and how they affect you. During this session, we will find a healthier way for you to interact with your coworkers. I want to get a clear understanding of what is going on. Do you avoid social gatherings due to your fear of relationships? Yes, almost all the time I avoid outings with my coworkers or striking a conversation with them. It sounds to me that you are ready to come out of your shell and form a relationship both in your personal life and your work life. I absolutely do. I will love to start establishing relationship with my colleagues. I came to the realization that I love the work I do, minus the presentation part. And I also like my supervisor, whom has been very understanding of my mental illness. I foresee being in this company for a long time to come, so I will definitely like to form a relationship with my coworkers. Let's explore work. How are things generally at work? Work is fine. I do my work and then go home. I feel like my coworkers get along so easily and I am the odd one out. I feel like they talk about me since I exclude myself from everything. How do you feel about not participating? It makes me feel awkward, but at the same time, I feel like it's safe. What do you mean by feeling safe? I mean, I don't have to worry about talking to them or anything. I work, go home, and that's it. So you think it's good that you don't socialize with your coworkers? I don't think it's good per se, but I don't have much to say and I don't want to feel weird around them. What if we have different interests? Well, our session today will involve finding ways to engage with your coworkers in a way that makes you feel comfortable and natural. We can do role play where we can practice striking a conversation with a coworker. How do you feel about that? I guess we can try. Okay, you can start by approaching me like I'm your coworker. Hello, Sheila. Hello, Ernest. How are you today? I'm okay. So have you seen any good movies lately? Oh, yes. I saw the new Marvel movie, which was absolutely fantastic. Really? I haven't had a chance to see that yet. I don't want to ruin it for you, but you have to see it. Well, I will try and see it this weekend. Oh, that's fantastic. Let me know what you think of it on Monday. Sure, thanks for letting me know. Anytime. So how did that make you feel, striking up that conversation? It actually wasn't bad. If it was real life, I will be excited to watch the video and share my opinion with her. At least I finally spoke to someone. Well, I will consider that good. Would you? Yes, I don't think it's bad at all. I can definitely do that. If you were to describe your feelings before initiating the conversation, what would that be? Anxiety, since I don't know if they will have the same interest. And even if they don't have the same interest, it will be a learning experience, right? You will ask them what movie they are interested in, and have interest in, and they will respond positively to you. I guess that won't be bad. How do you feel about trying it? I mean, I guess we can try it. I guess it was the same idea of coming here to establish a relationship with you. I find it easy to talk to you. I guess if I talk to other people, it will become easier too. Yes, you don't have to have a long conversation with them. You can start off by saying hi and then progress to finding out what your interests are, like we just did. This is how you can establish relationship with your coworkers. Okay, I will try and do that. Well, I am glad you came in today. I look forward to hearing about your experience during our next session next week. Next will be modality number 3, which is exposure therapy. How are you doing today? I'm doing okay, I guess. So I'm aware that you came in today due to your fear of presentation at work, which is causing you to miss work. Yes, I've called out several times due to having a presentation at work. I can no longer afford to call out again, and I decided to seek help to overcome my fear of presentation. Often, when we are anxious, we start to avoid what makes us anxious. In your case, it will be presentation at work. Avoidance may be helpful in the immediate situation, but it can be harmful in the long run since avoidance reinforces the fear. One of the most powerful tools of helping with your anxiety is facing your fears. How does that sound to you? It sounds pretty scary. I'm not sure how I can overcome my fear of presentation at work. I want you to understand that although it might sound scary, we will work through it, and you will realize that anxiety prevents you from realizing that the things that you fear are not as dangerous as you think. Through exposure, your brain will be rewired to know that you are safe when you encounter fear, which will be presentation. I just want to be comfortable with all my fears, since my fear of public speaking is hindering my relationship with my coworkers and my job functions. I want to make sure I understand you. Your fear of public speaking is preventing you from performing your work duties and interacting with coworkers. Yes. If you were to make a goal relating to your fear, what would it be? Present at home since there are no audience. Well, I think that's a great start. But before we do that, I think it will be best if you watch people give presentations. A good place to find that will be on YouTube. How do you feel about that? I think that would be fine. It's funny, I never thought about that. Also, I have another assignment for you. After watching the videos, I want you to record yourself giving a presentation and bring it to the next appointment. I think this will help us start to get comfortable with speaking in front of people. When you do this, you will be provided with extra support whilst you are building your abilities. You don't have to record yourself for a long time. You can modify the length of time that you do an activity. So recording yourself for a minute, it's easier than 10 minutes. We will continue to engage in you recording yourself and also presenting in front of me to eventually build up the support that we need so we can decrease your anxiety. How does that sound? I think this is great. I think I can do that. Sounds good. So I will see you at the next session. Thank you. This concludes the 3 therapy modalities. Thank you.